Hello, everybody. In the October article of Health Leaders Media magazine, Gina Shaw brings us an interesting article about cloud computing. Cloud computing is a concept of sharing a web-based resource to store information and material. And according to Gina Shaw, this is a very good uh, system for healthcare organizations to exploit. She said that in addition to being a common, easy to use platform that anybody can access, cloud computing has very many benefits. For example, users can share information seamlessly in real-time manner across different devices within the same organization, and even different devices between different organizations. This is a very cost-effective way because organizations only pay for what they use. So you can see that small physician practices really appreciate having a place to store data without having to invest so much money in buying a whole information system. It appears, according to Gina Shaw, that healthcare leaders are very interested in cloud computing because, according to a study conducted by Ipsos Research for Microsoft, 49% of healthcare leaders stated that the organization is at least using cloud computing, and the most common use for cloud computing were collaboration in 56% of the cases and storage in 48% of the cases. Some very interesting examples that Gina Shaw shared with us include Seattle's Children's Hospital, South Peninsula Hospital in Homer, Arkansas, and Community Memorial Hospital in Ventura, California. These three or four systems are testing the new cloud-based technology for sharing image studies and reports. Now, the San Diego-based Emix is vendor neutral, and that means that the organization testing the system are using a variety of PACS vendors and uses pay-as-you-go model. That is the greatest thing about this thing, pay-as-you-go. That means that you don't have to shell out all the money at once. In Yale, Connecticut, in New Haven, Connecticut, the 944-bed Yale Hospital is planning to use the cloud computing platform to collect and share diagnostic imaging information on its new 168-bed Simlos Cancer Center and within its trauma unit during emergency transfers from remote locations. So the system, called Life Image Online Medical Image Platform, will allow patients, physicians, and hospitals to electronically collect, share, and view diagnostic imaging records from any facility, and that requires no special equipment or storage devices. How good is that? So the program uses diagnostic imaging management interface that any employee can use to upload or access patient medical imaging information, and then the images are transferred to the organization PACS system. That is fantastic. Another example that is using cloud computing is Aetna Health Insurance Company, which is based in Hartford, Connecticut. And Aetna has launched a new cloud computing and clinical decision support solution that combines information from electronic medical records, claims data, medication, and lab data with an evidence-based clinical decision support. So the data is delivered by the physicians, or the data is delivered to the physicians and patients through an IBM cloud computing platform. Okay, here's another good one. Example uh, given by Gina Shaw. Sharp Community Medical Group in San Diego is also using the collaborative care solution to help physicians and nurses access information throughout the group's multiple electronic medical record system. That is very good. And finally, another good example is Health Alliance Hospital in Leominster, Massachusetts. This Health Alliance Hospital is using wireless computing and secure internet access to give physicians access to records, including large BACS files from almost anywhere and on multitude of devices. Now, this Wi-Fi is from Health Alliance Hospital in Leominster, Massachusetts. Is benefiting from the new increased capability because the new Wi-Fi channel can handle greater amount of data than the earlier versions. That is something positive. I think this is a great article by Gina Shaw, Senior Technology Editor for Health Leaders Media. Thank you very much.